Now we can take all these form factors and put it in a simple program that people can do at home and still execute the results that we're used to seeing clinically, but in a home model.
Yeah, as you were saying that, I'm just thinking about the first computer, right, that took up an entire building, right, and then it was a room, and now we all walk around with it in our pocket. Right? So what's happened in technology as it has shrunk and become, it's smaller, more usable, and more affordable. Now we can take solutions that we use in the clinic, but we can scale those down, make them affordable, people do at home, right? What I like to say to my clients is, we can eliminate time and space. Now you don't have to come to the clinic and you don't have to pay the cost of a clinic visit every time. You can do this in the convenience of your own home for a fraction of the cost. Outcomes go up and the fussiness of it, the pull on resources, right? So our primary resources are energy, attention, and time and money. So if we can lower people's investment in their resources but increase their outcome, that's a win, right? I mean, I think that's where CerebralFit comes from. For you and I, both having done the clinic thing for decades, we see being able to bring this to people's homes as probably that's the next frontier.
And hopefully, I mean, the nice thing with what we're doing is we're not focused on a particular symptom and we're not focused on a particular disease. We're focused on an organ system. That organ system just happens to be a very important one in your body, which is your brain, and every electrical wire that comes out of your brain. And as the world progresses and people start to understand that this is a commodity that needs to be trained and it needs to be reserved. And we don't have the resources, and medicine hasn't provided any of the solutions where we can look at this capacity and say, hey, this is something that shouldn't get used to just losing over time. We should get used to exercising this over and above what we'll say crossword puzzles end up being. And we should look at this as, a commodity that we want, just like a muscle, just like our strength, just like our flexibility. We should want to have resources and equipment available to be able to implement these resources so that we can go ahead and not be, I'm going to say, subject to the inevitability of not being able to know our own names. And I think in medicine, unfortunately, that's getting to be the norm, and that's getting to be an accepted norm, where when I started even 20 years ago and we had these conversations and we had these patients, there was a tragedy with these diagnoses, and we would look at these as a tragedy with this person, where we'd put them in a nursing home and we would say, okay, throw away the key, because either they're dangerous to themselves or they're dangerous to others, and that ends up being a case where that person needs 24 hours care. And we never really discussed in medicine, and we never discussed in the public, that probably was a 25-year-old problem. Other than an acute accident, and people will say, well, a stroke is an acute accident. Well, we know that a stroke is accumulation of disease process that ends up into the acute reaction. But even when we're looking at people with strokes and we're looking at people with cerebral accidents, the capacity of that brain to respond and relearn is a lot more than what we thought it was. Unfortunately, our tools to do that, namely physical therapy, probably don't meet the demand of the expectation of the patient and their family. So now when we have technology, we can meet that person in their home and say, I don't think we should just settle for that. This isn't going to be good enough, and we definitely don't want to be handicapped for the rest of our lives or be a burden to our loved ones. There's something proactively that we need to be doing, and there has to be a system together that we can put in place where we're saying we're actively massaging or exercising or lighting up or facilitating the ability of the brain to do more than what it could do yesterday. And yeah, we are going to decline with age, but just like flexibility and strength, we should look at that as the ability, and we should look at that as the opportunity to use equipment to make sure that that strength and that flexibility are minimized as we get older.
Exactly that, right? So it's a downward slope, but can we slow that slope? And can the endpoint not be as low, right? I mean, so without any kind of fantastical thinking that we're going to end aging this week, but soon.
Correct.
But in the meantime, can we slow the downward slope, and can we make the endpoint not as low as it was going to be? I think absolutely the answer is yes, we can do that. And we talk about the physical body, right? We learned about exercise and the value of exercise. And nutrition, we've learned about the nutrition, how to feed the body. So we've done a really good job with the body. Where we haven't done a great job is with the brain, right? So for the longest time, it was just a locked box. And we would try and get to the brain indirectly, right? So maybe indirectly try and get through the blood-brain barrier with some nutrients or some pharmaceuticals. Or through talk therapy, we'd try and get to the brain through the mind. But everything was an indirect approach to the brain. Well, now with these technologies, we have an ability to go directly to the organ itself, right? And I often tell my clients, it's like, if you went in to talk to your cardiologist and the cardiologist said, well, I want to watch you walk around the room and do this puzzle and then diagnosed your heart condition, you would leave your cardiologist, right? Like today, you would go to somebody who's going to do a calcium scan and really look at the image of your heart, see what's going on, and then treat the organ itself, right? So now that's what we're able to do with the brain. We can do functional imaging, we can see what's actually going on in that brain, we can look at where's the dysregulation, and then we have technologies to be able to regulate the dysregulation, right? So this is a first time in, well, we could say in centuries, but certainly in decades, that all of the research that's been done is coming together and meeting application, right? We're finally applying what we've known. And again, economy of scale, we've been able to bring the technology down to where it's affordable and easy enough for the average person to be able to treat their brain at home in a way that is effective. And that's, again, what are we excited about? We're excited about bringing that reality to our patient population and to a broader audience than what we can see in our brick and mortar clinic, because we don't need to have the clinic anymore.